So skin cancer, I guess, is when the DNA of the skin gets damaged, and by doing so, it causes those cells to replicate at a much faster rate than normal.
Okay.
And there's three main types of skin cancer. So your most common type is basal cell carcinoma, which is abbreviated BCC, and that is way over 1 million cases a year of that in the United States. The next most common type is squamous cell carcinoma, that is SCC for short, and that's not quite as common, and that has the potential to spread to lymph nodes.
Okay.
Those two, the BCC and SCC, are the most closely related to UV sun exposure. And then you have melanoma, which is the most severe one and the least common one. It can spread to the lymph nodes, the liver, the brain, and other organs, and so it is by far the most fatal. They develop in different ways. So to start from melanoma has more of a genetic predisposition. So
Okay.
somebody who has a family history of it has a much greater risk of getting melanoma. The other types of skin cancer, that genetic link is less well defined. But what we do know is that UV sun exposure no doubt increases the risk. The higher the amount of UV sun exposure, the higher the risk of developing a non-melanoma skin cancer. I would say the most common age range is about 50 for people to get their first one. However, I have seen people in their low 20s develop them, as far as the non-melanoma skin cancers. Melanoma, all different ages. I've had kids that have had melanoma as young as 8 years old. I've had people that I've diagnosed with their first melanoma as late in life as 85 years old. Sunscreen works by blocking out those harmful UV rays and thereby protects the skin against them. I recommend every 2 hours if they're going to be out in the sun all day, and if it's intermittent sun exposure. So for example, if it's somebody who's working full-time but during lunch they need to run out to go get lunch, then they need to run to the bank, what I typically will recommend is that they at least use sun protection on their face once a day. But I do have one caveat, and I say this from obviously my experience as a medical professional, but also from my experience as a father, that there are two main ingredients in the sunscreen that I want my kids to use and no other ones, and that is zinc oxide, and the other one is titanium dioxide. Those are what's known as physical blockers. And the reason why I like those, there's a few reasons, but number one is that as soon as you put it on, it's working. So if you put it on right now and you go out into the sun, you're protected. Chemical blockers, you need about 20 minutes to a half hour before they've kicked in. The second one is that there have been, although there are some poorly designed studies, however, there's been some theory that they may affect hormone levels, and so with those, being chemicals, I'm not really as into using those. I recommend to my patients that they go with the zinc oxide, titanium dioxide only. What I do recommend, yes, I do. So something that I think is very important is that, we're telling everybody to wear sunscreen to block out the sun. People do forget that the sun is a very good source of vitamin D. So I do recommend with people that are protecting themselves from the sun on a daily basis that they supplement with vitamin D3. So in typical adults, I usually recommend 2,000 international units, and in kids, whatever is present in their multivitamins is usually good enough. But I do recommend that they get it in some supplemental form, because vitamin D deficiency is a big problem.